Let's bring in CBS News medical correspondent Dr. Céline Gounder. She's also editor-at-large of public health at KFF News and an expert on infectious diseases. Good morning, Céline. So we just heard the NIH say there is nothing to worry about. But after the experience that many Americans had during COVID, there is suspicion of public health proclaiming that everything is going to be okay. And maybe this isn't COVID 2.0, but it could be something else that is scary. So allay our fears.
So first of all, Hantavirus is not going to be COVID for a whole host of reasons. So yes, it is more deadly if you get it, but the key word there is if you get it. It is less infectious. COVID was airborne. Most of the transmissions with hantavirus are direct, intimate contact. Rarely you have maybe a little bit further spread, what we call droplet spread. So those big, juicy droplets when you sneeze or cough. But that still doesn't travel that far. So we're talking about limited. The incubation period here is long, which actually works in our favor because that gave us time to contain the situation. This is also a virus that infects deep in the lungs, not up in the upper respiratory tract. So it's much harder to spread a lot of virus when you breathe out or when you cough. So for a whole host of reasons, this is a very different virus.
So we've got 16 Americans that are at this facility in Nebraska. They're quarantining. What does that look like? What are the conditions? What are the steps that they need to hit before they're released? I mean, they're not just running out into the wild again, right?
So there are different words here that get thrown around that I think people sometimes confuse and happen during COVID. So you have quarantine, you have isolation, you have biocontainment. So quarantine means you've had exposure, but you don't have symptoms, you're not testing positive, you don't have hantavirus, at least not yet. And so those people are in what looks more like a dorm or a hospital room. It's really just having you be under observation. When we talk about isolation or biocontainment, the people who are going there are people who have symptoms, who've tested positive, who perhaps actually do have hantavirus. And those are very different situations. In the latter, you want to actually have medical care available to them because when people get sick with hantavirus, they get sick very quickly.
So the incubation of this virus is 8 weeks inside the body. So is there risk when they do get home that it's still there?
No, once you've cleared it, you've cleared it. Okay. So, you know, and once you're out of that incubation period, nothing to worry about anymore.
Okay. All right. Well, that's reassuring.
Definitely reassuring.
Dr. Gounder, thank you so much.